When we look at medications for cognition, the memory or the thinking component of Alzheimer's disease, we have two classes of drugs that we can use. In the early stage, we use the cholinesterase inhibitors. What is that? It's a fancy word for medications like Aricept, or its generic form is donepezil, galantamine or razidine, Exelon or rivastigmine. These are medications that help make a chemical available in the brain that we know gets depleted in the early stage. These are medications that we start slowly. We typically use a half dose, and each one has a different starting dose. So donepezil, for instance, is a 5 milligram dose. We do the half dose every day for 4 weeks, and then if tolerated, we increase to the next level of medication. So in donepezil, that might be 10 milligrams. In the rivastigmine patch, we might go from 4.6 to 9.5. And all of these then have options to go higher based on tolerability. These are drugs that are associated with about a 10% incidence of GI complaints. So if we're starting these at any point along the way, we want to watch for things like upset stomach, queasiness, nausea, vomiting, frequent loose stools, or diarrhea. We want to watch for a fall off in appetite. Sometimes people will experience a 6-7 pound weight loss as the medications are started. Donepezil in particular, but certainly all three of these drugs can potentially cause vivid dreams. So this would be your reporting to me that your loved one seems to have very active dreams. The loved one might even report to you about having these technicolor dreams or nightmares. They can go either way. I have some people who say, oh, please don't take the medication away from me. I really like my dreams. Other people are clearly disturbed by their dreams, so it can be a side effect of the medication. Can also see complaints like runny nose, and they can lower blood pressure. In the moderate stage, we add Namenda or memantine. Again, we start slowly. We have options for one of two avenues with memantine. The traditional is the immediate release, which is generic memantine. We start with 5 milligrams and we build over a period of a month to 10 milligrams twice a day. The newer formulary is the Namenda XR, which we start at 7 milligrams and build over time to 28 milligrams. Again, GI side effects can be a concern with this medication. We tend to see constipation more as a side effect with the memantine, diarrhea more with the extended release. Namenda can have paradoxical confusion as one of its side effects, and that would be a picture of a relative level of confusion or clarity. Last week, you start the medicine this week, and you call me up and say, wow, she's not putting words together that are making sense, or just seems agitated, more distressed, and it seems to coincide with the onset of the medication. Because it acts in the brain, it also has the potential for dizziness and headaches. So those would be the main side effects. So while we look at the cholinesterase inhibitors or Namenda as memory pills, they also can have some effect on mood and behavior, and really what we're preserving with them over time is function. With all of these medications, it's important, as I said, we start low, we go slow. It's important for you as family members to make notes. When did we start the medication? When did we notice any kind of side effects? Because sometimes it's only when we go to the higher dose, for instance. People might tolerate donepezil 5 milligrams, but when we go to 10, that's too much. So those are medications that we use for the memory or the cognitive or the thinking symptoms of Alzheimer's disease.